about most cost-effective treatments for lung disease identified. It referred to literature review, the economic costs of lung disease and cost effectiveness of policy and service interventions, 2017. Actually, I like this because it is the authors from University of York and YHIC, where I studied and make my summer internship. Anyway, so they summarize about around 6 studies talking about the, I selected just one topic, that is COPD and smoking cessation. COPD and smoking cessation. In the article, there are many preventive methods which are cost effective. Even يعني بصراحة إحدى الميثودز إنه نبعت ناس على الكوميونيتي ليفل يروحوا على بيوت الناس asking about obstructive sleep apnea. Screening for obstructive sleep apnea, it was a cost-effective methodology. So many of the prevention is very useful and cost-effective. I select one of them, cost effectiveness of an intensive smoking cessation intervention for COPD patients. The people, the patients are COPD patients. They compared high intensity smoking cessation program, more counseling, more calls with patients, intensive treatment with medium intensity treatment. And the outcomes were additionally quitters gained, exacerbation prevention, hospital days prevented over 12 months. So the idea to see whether this program will decrease hospital admissions or increase quitters. Maybe the patient will not quit smoking, still COPD and a smoker, but we want to find whether exacerbation prevented and hospital days prevented. In summary, they used this model for estimating the costs and consequences. And this is the summary of the costs. And overall, the average patient receiving SST, this is the severe or the intensive, intensive therapy, generated 581 euros in healthcare costs, including the costs of smoking cessation program, versus 595 euros. So the severe or intensive program less expensive than the intermediate one. On the other hand, the SST is also associated with a lower average number of exacerbations and hospital days per patient and higher number of quitters. So we can find it that it yields, it's more effective and less expensive. So as we know, in this case, we don't need an ICER and we don't need a threshold, just do it. So if we think about this idea, and this is a sensitivity analysis, they used a Monte Carlo simulation. Anyway, I want just to highlight the idea. This is for COPD alone. If we want to combine this program for other diseases, cardiovascular diseases, stroke, etc., I think it will be a very cost-effective issue to treat patients who are smokers by intensive treatment. يمكن كان دكتور منير قبل في الاتصالات التحضيرية يتحدث إحنا one of the main limitations that the patients are not taking the full dose, required dose of treatment, the full package of treatment. But I think the limitations of application, are the medications available at the Ministry of Health? By the way, I have every weekly clinic, tobacco cessation clinic. So I found the limitation in the medications that are available. Also, we have shortage in trained health workers who are able to provide this service. And another question, what is the budget impact of providing these medications for patients, keeping in mind that the taxation for smoke tobacco is not that enough to decrease the consumption of tobacco products. This is briefly Thank you very much.